Hi, my name is Lisa Braley, and I am a dietetic intern at OSF St. Francis Medical Center. Today I'm going to talk to you about several tips on managing nausea and vomiting while you're going through your cancer treatments.
Let's start by first defining nausea, which is a feeling of queasiness or being sick to your stomach, whereas vomiting is throwing up.
Nausea or vomiting can happen to people who are fighting cancer for many different reasons. Cancer treatments such as chemotherapy, radiation, they can both damage your healthy cells in your digestive tract, which may lead to nausea or vomiting.
During chemotherapy, nausea or vomiting can start the day of treatment and last up to 3 or more days after the treatment. With radiation, nausea and vomiting may start 1 to 2 hours after treatment and last for several hours.
Nausea and vomiting can be caused by the cancer itself or as a side effect of intense pain, fatigue, illness, medication, or simply the stress of coping with cancer.
Other illnesses, such as constipation, infection, gastroparesis, kidney disease, vertigo, uremia, or drug withdrawal may contribute to nausea or vomiting. Some specific factors that may increase your risk of developing nausea or vomiting include being a premenopausal woman, being younger than 50 years, if a tumor is present in the gastrointestinal tract, liver, or brain, being a non-drinker, having a previous history of motion sickness or hyperemesis, having a warmth or hot feeling after chemotherapy, a generalized weakness after chemotherapy, or having anxiety related to chemotherapy.
There are several health problems that are related to nausea and vomiting as side effects.
Dehydration is one serious problem that can occur with prolonged nausea and vomiting. Dehydration occurs when the body does not have enough water. One clinical test that you can do at home to test for dehydration is to pinch the skin between your thumb and forefinger. Skin with decreased turgor remains elevated after being pulled up and being released. This is a sign of dehydration.
Call your doctor if your vomiting is really severe or it lasts for 1 to 2 cancer treatments because it can result in not being able to continue your radiation or chemotherapy treatments, as well as broken bones or even the reopening of surgical wounds. Malnutrition is also a very big side effect that can occur after severe nausea or vomiting.
Additional nutrition factors associated with nausea and vomiting include constipation, an electrolyte imbalance, a rapid weight loss, low blood pressure, fever, aspiration pneumonia, and an esophagus tear.
Prescription medications may help with nausea that's due to cancer treatment. Antiemetics or anti-nausea medications are commonly prescribed by your doctors. It's important to take these medications as prescribed before meals in order to allow enough time for them to provide relief before you start eating. Let your clinician know if your anti-nausea medications are not working so that adjustments can be made accordingly. Physical and mental relaxation techniques may also help with nausea caused by anxiety.
According to the National Cancer Institute, acupuncture is often effective with treating nausea. Talk to your doctor or nurse if you are interested in this option. Additional relaxation exercises such as deep breathing, meditation, or prayer may help you feel better before receiving cancer treatment. The Cancer Center for Healthy Living has free counseling services that address these issues, such as individual counseling sessions and occasional workshops. Contact the main phone number at 693-8139 for more information.
Additional tips for managing nausea include resting after meals. Just make sure you're sitting down and not lying down. Wear comfortable, loose-fitting clothing, and keep a record of what foods make you feel nauseous, and then share this with your doctor or nurse. They may have some suggestions for how you can change your diet. Avoid strong food and drink smells. You could ask a friend to come over and help you cook, or family members. That way you're not in the kitchen surrounded by all those smells associated with cooking. Open a window or turn on a fan if you're feeling hot and stuffy, because that can help some of the air move around.
Specific nutrition strategies that may help with nausea include eating foods that are easy on your stomach, such as white toast, plain or vanilla yogurt, and clear broth. In general, lemon, lime, and other tart flavors are easy on your stomach. Eat 5 to 6 small meals instead of 3 large meals each day, as many people find it easier to eat smaller amounts of food. Do not skip meals or snacks. An empty stomach can make nausea even worse. Choose foods that appeal to you. Avoid foods that make you feel sick. It's also important to not eat your favorite foods so that you do not associate them with feeling sick. Let hot foods and drinks cool down and cold foods and drinks warm up before you consume them. Add ice to warm foods or warm up cold foods in the microwave. Sip small amounts of liquids during your meals. Eating and drinking at the same time may make you feel full or bloated. If you are nauseous in the morning, try eating dry toast or crackers before you get out of bed. Plan to eat when it is the best time for you. Some people feel better eating a light meal or snack before treatment. Others may feel better getting treatment on an empty stomach, which may mean not eating for 2 to 3 hours before treatment.
Similar to nausea, prescription medications are available to help with vomiting. The type of cancer treatment you're receiving and how you react to it will affect how long you need to take your medications as far as long term. Tell your doctor or nurse if your anti-nausea medications are not working. I can't emphasize this enough. One way to prevent vomiting is to prevent nausea. So follow all the tips that we discussed earlier as far as preventing nausea.
Specific nutrition strategies to help with vomiting include following the tips we discussed earlier to prevent nausea. Do not eat or drink anything until vomiting stops. Slip clear liquids once vomiting does stop, such as water. Try full liquids after you can handle clear liquids without vomiting. Eat 5 to 6 small meals a day instead of 3 larger meals. Rinse your mouth to remove a bad taste before eating.
Alright, so to remove the bad taste from your mouth following an episode of vomiting, you can try this mouthwash solution that we're going to make now. Start off with 4 cups or 1 quart of warm water, and you'll add 3/4 a teaspoon of salt and a teaspoon of baking soda. We'll mix this together.
And this mouthwash will not only remove the bad taste after vomiting, it will also help prevent dental decay from acidic contents of your stomach.
Some foods may actually increase your likelihood of developing nausea or vomiting during cancer treatment.
These foods to avoid include fatty, greasy, or fried foods, very sweet foods such as candies, cookies, or cake, as well as spicy, hot foods, foods with strong odors, high fiber foods, foods that give you gas, and your favorite foods, as I mentioned earlier, as well as coffee, tea, and alcohol.
After your vomiting has stopped, try small amounts of clear liquids,
such as broth, apple juice, gelatin, sports drinks, ginger ale, clear pop, such as Sprite, Sierra Mist, or 7-Up, and commercial nutrition supplements. Commercial nutrition products that are both high in protein and a clear liquid include Resource Breeze from Nestle, Enlive from Abbott, and Isopure Plus. After vomiting has stopped for 8 hours, try solid foods that are low fat and low fiber, such as toast, crackers, and pretzels, white rice or rice cereal, oatmeal, potatoes, fruit juice, bananas, applesauce, clear broth, yogurt, sherbet, angel food cake, baked or boiled skinned chicken, and eggs cooked without added fat.
Nausea and vomiting can occur for many different reasons during your cancer treatment. It can lead to serious health problems such as dehydration or malnutrition. We covered some tips to help prevent and treat nausea and vomiting during cancer therapy. Remember that some foods can increase the likelihood of developing nausea or vomiting, while others can help decrease the likelihood. Low fiber and low fat foods are good to eat about 8 hours after you're done with vomiting. Thank you so much for watching this seminar on tips for managing nausea and vomiting.